All right, good afternoon. Welcome. I am excited to welcome all of you to this press conference announcing an agreement that the city has entered into to provide an on-site clinic for these Clarksville City employees. I'm going to give you an overview and then I'm going to introduce our partners to the project, and so that you'll have the opportunity to hear from them directly. As you all know, helping Clarksville become a healthier, fitter city has been one of my priorities since I took office. Beginning with the creation of the Mayor's Fitness Council, I began to look for ways that we can encourage individuals, businesses, organizations to address our collective health issues. I believe that the city should and can set an example for others. I am, as you know, also committed to the city saving money wherever possible and practicable. And in this case, by building an on-site clinic for our city's employees, we are able to offer more healthcare options and encourage them to become healthier and save money for our employees and the city of Clarksville. Let me give you some details about the clinic. First, as you probably guessed, it's going to be located right here where we're standing. This building has been used for some time as a storage building, and we've begun to clear it out, and it will be transformed over the next few months into a state-of-the-art professional healthcare facility. Here, our employees and their dependents will have access to care for a host of medical needs, including primary care visits, preventive care visits, care for acute and chronic medical issues, occupational care services, immunizations, prescription services and medications, lab work, wellness assessments, coaching, and a 24/7 nurse line. And these are just some of the benefits that I know are going to be offered. We're very happy to be able to offer this benefit to our employees. As I've said before, I believe that the city of Clarksville has the very best city employees in the entire state of Tennessee, and they deserve the best care that we can offer them. This health clinic will also provide the opportunity to assist them in doing their jobs. Studies have shown that companies and entities that offer this kind of option see an improvement in productivity and work attendance and a decrease in overall healthcare costs. As more employees use the facility, the city's healthcare costs are reduced. Let me give you an example. Imagine that you have an employee, they've been working on a computer all day, and they develop a headache. Now say that this particular employee has children that has friends that have learned that some of them are suffering from a virus. So rather than having to take the day off and pay the copay for a doctor's visit, this employee can visit this clinic, get a quick diagnosis, get some medication to alleviate the pain, and then return to work. She's gotten the medical attention she needed. She didn't have to use a sick or annual day, and is relieved to know that generally she's in good health and not suffering from the virus. There are, of course, many other examples of saved time and money that will come to fruition thanks to this clinic. And more importantly, the clinic will be available to our employees, and there are over 1,000 of the people like that are working for the city full-time and all of their dependents. These services, including the staffing decisions, will be made by our partner in this endeavor. After an RFP process and a thorough review, we determined that the best services would be offered by CareHere of Brentwood, Tennessee. I'm going to let them discuss their business model, and if you have questions about that, but I just want to say that CareHere has a reputation for excellent care, and in response and their desire to work with the city will do more than treat illness and injuries. It was important to me to have a partner that is committed to offering programs that work towards preventing illnesses and injuries, and I believe CareHere will do just that. So on behalf of CareHere, we have Ernie Clevenger, who is the president, Brindy Keeney, who is the vice president of wellness, Lee Angela, the vice president of purchasing, and Andy Wyatt, the key account manager. And I want to thank all of them for being with us here today. And I may have mispronounced some of their names, and for that I apologize. I'm just reading it off the script. But before I recognize Mr. Clevenger, I want to say a few words about someone who has been instrumental in this process, and that is Mr. Will Wyatt. I know that he needs no introduction to all of you. He's the Director of Human Resources for the City of Clarksville, and he has been instrumental in making this clinic a reality and in bringing CareHere to Clarksville. Now it's my pleasure to introduce Mr. Ernie Clevenger.
Thank you, Mayor, and thank you for the folks at the City of Clarksville, for Will White, who enabled this process to take place. We are absolutely delighted. We are honored to have been selected to be the manager of your on-site clinic. And Ms. Mayor, thank you so much for this opportunity. We will work hard to put our best feet forward, and we hope three things will occur. Number one, we hope that the employees and their dependents and eligible folks on the plan improve in their health. Second, as the mayor indicated, we know that the cost, the rate of increase of year over year will be managed, and that decrease will go down because we've seen that experience. And third, we hope we will see productivity among the city employees improve. It's not that we're geniuses or better than others, but when we find that when access to care and the barriers to care go down, that access improves, these things happen. Get this, 1 out of 5 visits in the first year will come from a patient who has not seen a doctor in over 10 years. 1 out of 5. So to be able to catch things early, to be able to better manage it in order to move behavior in a healthy direction, it gets good results. So again, we're deeply appreciative to the city and to Will and those other decision makers in making this possible. We are welcome to answer any questions that you might have.
We're happy to take any questions that any members of the press have that they would like to hear. We can hear from Mr. Clevenger or anyone else. Maybe I said it all in my remarks. Maybe you got everything you needed to know. I will say this to everyone here. We will be putting out some additional information from CareHere about the exact parameters of the program and the offerings that will go forward as we proceed in this process. We're just ready to get started on transforming the building behind us into the clinic, and we'll start to develop the exact parameters. Yes, you have a question?
I do have a question.
Okay.
Actually. So it'll be available to the care will be available to employee dependents, so children will be able to get care here?
It will, and I'm going to I don't know if Mr. Wyatt needs to come up and explain that, or maybe Mr. Clevenger can do that.
That's our option, right? I mean, cradle to grave.
Yes, all those individuals that are eligible on the health care plan, so employees and family members, even those children who need a sports physical or immunizations, or moms and dads who are the spouses of employees, those are the patients that can come and use this clinic.
Will, do you have anything else to add to that?
I think you said it well.
And like I said, we'll be getting some additional information out to all the employees and to everyone else so they'll know the exact parameters of the program that we'll be offering. But yes, the dependents will be able to use the clinic. Any other questions? Well, another one? Yes, you may ask all the questions you want.
Staffing, so do we know specifically how many people are going to be staffed here?
Now that, I'll let Mr. Clevenger respond to that about the staffing.
The staffing that's going to be here is generally always a 50-50 mix, 50% MDs and 50% nurse practitioners and others. And there are good reasons for this. A nurse practitioner is a wonderfully talented individual. We find that they're more talkative with patients. They're less likely to prescribe a medication on the first visit. They look at care in more of a holistic view, diet, exercise, and so forth. However, there's going to be a complicated patient who is a diabetic, hypertensive, or high blood pressure, and that's a complicated patient that requires an MD. And so for those individuals, which is the bulk of the cost for the city of Clarksville, 85% of your cost is from chronic care. So these complicated patients require an MD, higher level individual, to help coordinate that care. Doesn't mean that they take it away from specialists. Specialists are still being used. But an MD will be used to help serve as a coach and to monitor and manage that care.
Do you have any more? Okay.
Kim,
Yes?
what are the hours going to be here, and what about late after-hour employees? Where can they go?
You know, again, I'll let Mr. Clevenger respond.
The final hours have not been determined. Those hours are based on the availability of the provider, it's based on the needs of the city, and importantly, the shifts. So as we've talked with Will, and to make certain that policemen and fire who are around the clock, we want to make certain that those people who are on the later shifts also have access to the clinic.
Again, that's one of those details that we'll get out to you as those final decisions are being made.
Mayor?
Yes?
Oftentimes, healthcare comes down to personal responsibility, and so is this center going to be part of also training people to have better nutrition and exercise and take things on themselves, as opposed to treating something after the fact, doing it ahead of time?
Absolutely, and I can tell you that wellness is part of this whole model. Preventive care is something that's very important in this whole arena of on-site clinics, and so there are going to be wellness assessments and others. And I know we have somebody here. Brittany, would you like to make some remarks about that?
Sure, thank you. Yes, and that's my role, is to help people get better with preventive care. All the employees will have access to 4 expertise in this clinic: a dietitian, a nurse, an exercise coach, and a tobacco cessation coach, and they will meet with the patients and help them learn how to change behavior. That's really where we want to move, as a healthier community.
Ms. Mayor, may I add one thing? We were drilled in the RFP on wellness and incentives. Will led that effort, and of the presentation that we were asked to respond to, more than half the time was spent, how do you move a behavior from A to B to a healthier position, both with incentives, education, and other tools.
So out with the biscuits and gravy, huh?
Well, I don't know about that, but I expect to have so many members of the Mayor's Fitness Council. I think everybody's going to want to be part of the Fitness Council because we're going to have such a fit city.
That's right.
I have another question. Will it also involve any chiropractic?
A good question. As you look at any specialty care, it's going to be based on the need of the patient. So as the providers assess the patient, if they find that chiropractic care needs to be brought in, or other kinds of care, if it makes sense for the patient and makes sense for the city, then we're going to suggest that to Will, our boss, and the mayor, and if they approve it, then we'll move forward with those services.
All right. Well, thank you all very much for coming today, and I hope that those of you that are employed with the city will be ready and soon make access to this clinic once we get it ready to go, and really let the employees know, because I think, as we've heard today, it's really all about prevention and wellness assessment. And so in order to make this project a success, we have to have individual city employees actually utilize the clinic. So we'll really be focused on utilization as we move forward. But thank you again for coming today.